Hi everyone. So last time we spoke about what the things that are done before surgery, and then we talked about anesthesia. Now today we are going to talk about the things that are done during surgery. So on the day of the surgery, either on the same day or the day before, I would come so that I confirm with you the diagnosis, I confirm with you the site, the surgery, and also the side. And that is particularly important for organs that are paired, like the arms, the legs. I'm sure we've all heard those stories or news articles we've read that someone has had the wrong surgery or someone has had surgery on the wrong side. They were supposed to have their right leg amputated and instead it was the left that was amputated. So for us to avoid such incidents, we mark the site and the side. So put a mark, and that is something that you're not supposed to rub off. Okay? Now after that, you're going to be taken by the porter. A porter is someone who basically transports you from your room or from the ward and takes you to the operating theater. Now once you're in the operating theater, you're received by a theater nurse. That theater nurse will ask you more questions, again, about your diagnosis, your name, confirm your file number, so that they confirm that you're the correct patient. And then they ask you about the type of surgery you're having, again, to confirm it's the correct surgery that we're planning. And then they ask you again about the side and the site of the surgery. Okay? Then that same nurse now will take you into the operating room where the surgery will actually take place. Once you're there, you're received by the anesthesiologist. He or she will ask you the same questions again, and they will also confirm with you your drug allergies. Because remember, they're going to give you so many medications to keep you asleep during the surgery. So they have to be 100% sure that they're not giving you something you might be allergic to. So once my fellow surgeon and I have dressed up in our theater gear, we've worn our surgical gowns, our masks and our gloves, we come over to you, we clean the area where we're going to operate, and then we cover up your entire body except for the area where we're going to do the surgery. And then we start off our surgery and we continue until we finish. Now, once the surgery is done, we do something called a swab count. Swabs are basically pieces of gauze. Gauze, it's like pieces of small cloth, like bandages, okay? And they are usually white in color. We use them to wipe off blood or pus or anything. So, and they usually come in multiples, okay? And so after using them, we have to confirm that whatever we had prepared for, whatever we had counted before the surgery, we count the exact same number once the surgery is done, so that we ensure we have not left any of them inside your body. Now after that, we close off, and now that count is also done for the instruments, so that again, we don't leave instruments inside the body. Once we've closed, you're reversed from anesthesia, but now for some patients, they're a bit too sick to be reversed, or the surgery was a bit of an extensive surgery, so they are taken straight to the ICU after the surgery. If not, these patients, they are woken up from anesthesia, but you're still not taken directly back to your room. What happens is that you go into something called a recovery room, or in our setup, it's called the post-anesthesia care unit, PACU. Now in that unit, they monitor your pulse, they monitor your blood pressure, they monitor your oxygenation. Once everything is confirmed to be okay, that's when you're taken back to your room. Now in this PACU, you may spend about an hour to 2 hours, maybe even 3 hours, just so that they ensure that all your vital signs are okay, so that complications do not arise while in the ward. Now, on the next video, we are going to talk about the things that are done after surgery. That is on the next day. Some people wake up and they find they have some tubes coming out of them and they don't understand what they are. That's what we're going to talk about on the next video. Stay tuned and stay healthy.